Welcome to CMM Off the Page, a podcast brought to you by CMM Magazine, a brand of Care Choices Limited. Guest speakers will equip listeners with take-home advice to support best practice in the social care sector. The podcast is available to listen to on Spotify, Apple Podcasts, and to watch on the CMM website. We hope you enjoy this latest episode.
Care Choices is a multimedia publisher, event organiser and podcast producer. Care Choices works alongside industry governing bodies, local authorities and care providers to publish impartial information for individuals and their families or carers. With 30 years publishing experience, the largest portfolio of care and support directories in the UK and over 2 million page views annually, Care Choices is the perfect route for care providers to reach people actively seeking care and support. Contact Care Choices to discuss how we can help promote your business both online and in print. Give us a call on 01 223 207 770. We hope you enjoy this podcast.
So hello everyone and welcome to CMM Off the Page. Today I'm delighted to be joined by our co-host, Professor Martin Green OBE, who is the Chief Executive of Care England. Care England obviously being the membership organisation for smaller, medium-sized and larger care homes across the UK. Martin, we had the pleasure of Martin joining a previous podcast on the CQC regulation and also how to support the workforce with a particular wellbeing focus. If you haven't listened to that podcast yet, I encourage you to head over to the website. It's a very lively discussion. If you want to find out what Martin thinks of is the regulator fit for purpose in 2023, then do find out Martin's response to that. It's not a short answer, I would say. Today we're going to be discussing leadership and how providers can really excel in this category. So really interesting to hear that. So welcome, Martin.
Thank you very much. I'm really delighted to be here, and I'm delighted to be with such eminent company as well. And I think we're all going to have our own various views about leadership, and it'd be really great as well to tease out some of the issues that people have encountered through their work, and also hopefully that'll be helpful to current leaders, but also to people who are aspiring to be leaders and managers in our sector.
Fantastic. Yeah, absolutely, Martin. And it's wonderful to be joined today by Samantha Crawley. Samantha is a non-executive director at the Outstanding Society, as well as also being the Chief Executive Officer at Bracebridge Care Group. Samantha's got over a number of years, over 20 years, so many years of experience, and has also worked at some really large care organisations as well, and stepping into those leadership roles. So really looking forward to hearing from Samantha, whose vision for Bracebridge is to build homes which integrate tightly with their local communities to provide places where people are proud to live and work. And I think Samantha, Bracebridge try and have almost call their care homes local hubs, sort of within the community. So it'll be interesting to find out more about your model today and the care group itself. So welcome, Samantha.
Thank you very much. Good to be here. Very excited to be here. In great company as well. Thank you.
Thanks, Samantha. And finally, delighted to welcome Kathryn Smith to the podcast today. And Kathryn is the Chief Executive of the Social Care Institute of Excellence. Kathryn's also a regular CMM contributor to our news and magazine, just like Martin. And Kathryn has over 30 years of experience in the health and social care sector, sort of starting in sort of care homes in the private sector. And also Kathryn did a 2-year stint as an inspector as well. And previously the Chief Operating Officer at Alzheimer's Society, sort of really leading on the dementia strategy there, Kathryn, I believe. So yeah, looking forward to obviously the organisation, a number of training and development opportunities for providers to hear about today, and especially obviously focusing on leadership. So I look forward to hearing about how the organisation, Kathryn, is supporting providers in that particular area.
Thank you. Great to be here. Thank you.
Brilliant. Yeah. So I think obviously quite a broad one to probably start off, but it'd be great to hear from each of you really on what does effective leadership look like in a care setting, and what should providers be striving to achieve?
Well, I think first thing is you've got to have a really clear vision around your service, and you've also got to be making sure that everybody in your service understands not only your vision but also the values. I think if people understand both your vision and your values, that really helps them and enables them to make decisions for themselves. So what you don't want in care services are everybody having to go through a command and control process. What you want are colleagues who really understand what you're trying to achieve, really understand that the person we're supporting is at the very center of everything that we do, that you are there to do everything you can to give them a good life, so enabling people to make decisions that will be in the best interests of the person you're supporting. So I think those are the things that I would want to pick out as essential traits in good leadership in the care sector.
Yeah, absolutely. And Samantha, is that something that you agree with?
Absolutely. I mean, visions and values are key. Otherwise, we don't know why we're getting up in the morning. So to keep everybody working in the same direction, we have to have that. We have to continually check back and say, are we actually still working towards that? Or have we gone some way off piece? Because sometimes we do, so we just need to keep that in mind all the time. I think for me, as well as that, genuinely listening to team member feedback, genuinely engaging with team members really helps us as leaders, really keep that vision in mind. Because if we don't check with the team, do you know where we're going? Do you know why we're going there? Do you know what we're trying to achieve? And do you know what that will look like? How can they then really actually help support the organization, the people in it, or anybody if we're not really clear on that as leaders ourselves?
And Kathryn, did you?
Yeah, absolutely. I agree with what's already been said. And I think for me, good leadership is absolutely crucial in every social care service that I've been involved with throughout my career, in whatever guise I've been involved with. You can tell straight away if there's good leadership there, because I genuinely believe that the good leadership is a make or break for whether there's a good service offered. Individuals can offer a good service, of course they can, but for the whole service to be of a really good quality, really good standard, it needs good leadership. And I think some of what's already been said about making sure people have got a real clear direction on what they're trying to achieve and understand the vision of what could be there, how they're going to get there, and giving them the confidence of this could be brilliant and this is what brilliant looks like, and how much more satisfied in our jobs are we all going to be when we can provide a really great service, because that's what we're all here to do.
Brilliant. No, absolutely. And Martin, obviously the regulator regulates on how well led a service is, and that's something that obviously a lot of providers are trying to get that outstanding rating on. What are the sort of things that sort of, I suppose, impress the regulator from a leadership point of view? What sort of things do they want to see?
Well, I think they want to see the leaders who absolutely, as Samantha said, who listen, not only listen to people who use services, their families, but also their colleagues and staff. I mean, one of the things about really good leadership is that you understand that you don't know everything and you try and find out different views and opinions so that you're looking to make sure that the service is constantly improving and you're developing your service as you go along. I think also the Care Quality Commission will look for a sense of devolution in terms of power and autonomy for staff. So what staff need is the framework to be able to get on and do their job, not having to constantly check back, can I do this, can I do that? So I think they'll look for people who have the confidence, as Kathryn said, to deliver that really high quality care. Everybody working as a team, and that's another important element, I think, of good leadership. It's about how people encourage people to see themselves as part of a team, and that is everybody in a care service. It's about the people who do the domestic roles, which are vitally important, as much as it is about people who do the care and the management roles. And everybody needs to have a clear vision. They need to know what their role is. They all need to be part of that collegiate approach to delivering the best quality care. And I think those are the things that the Care Quality Commission would look for when they were trying to identify leadership. And also the communication between leaders and their colleagues is really vitally important. And it must be a two-way communication, as Samantha said, not just giving out instructions.
No, absolutely. And you mentioned management there, Martin, but for our listeners, they might be thinking about managing and leading, and how do we separate those two?
Well, I think the leadership piece is very much about that vision and values. The management piece is about how you deliver it in the most effective and efficient way. And I think one of the problems we have in this country is that we don't understand the difference. And too often we merge the two roles. And I think that's fine. You can merge them. But there needs to be a degree of understanding about the difference between that leadership role and then the logistic and operational bit, which is how do we make that vision real in a most efficient, effective way, and how do we use all the resources at our disposal, whether they're staffing resources or individual resources, to make sure that we're all facing the same direction and we're all working towards one clear goal.
I have met many leaders who haven't been in manager roles, and I have met many leaders who cannot manage. So I think it's very different. Like I during COVID, I experienced it firsthand where people, team members in the domestic team were leading the fight on infection prevention and control. So we can have, anybody can be a leader if they can grab the minds and hearts of people around them and show them exactly where they're going. So, and for me, that's a big thing. I think Martin's explanation of manager and leader is so key, because actually it's really important that we don't assume because somebody is a manager that they're a leader, or just because they're not a manager that they're not a leader. So that would be something for me. But going into spaces that maybe need work and maybe need some culture change, and the way kind of we move in the ship in a different direction, if you like, so the ship is going one way and we need to go another way. Really, it's always about the people within the service. So for me, it's about who lives there, who works there, who visits there, who are our partners. So I see family members as partners in care, very much so. So it's about, actually, they tend to know what the issues are. So if we're willing and brave enough to ask the questions, we will get the answers. And sometimes those answers are not pretty. Sometimes you're told exactly what it is. And I've been in many a room over the years where I've met night teams and day teams and looked at issues that are happening in care homes, and I have been told exactly why things are not working very well. But I think the answer's generally there within the space. And then, I mean, I'm sure Kathryn will talk about it, but giving people the skills and ability to do their roles and making sure that they're trained well enough to be able to do that is really key too. But first, we need to understand what it is we're dealing with. Is it a culture issue? So is the culture within the space so diseased, so disease spreads, that actually we need to stop it? We need it, like almost like antibiotics into it, kind of like, okay, we need to stop this in its tracks. How are we going to do that? And the people within the space can literally tell us how to do that. But as a leader, we've got to be brave and a bit vulnerable and be willing to hear that, because sometimes it's not very nice, but there's always a way through.
Yeah, and sort of being able to respond accordingly
Exactly.
in those difficult situations, which I was going to touch on, because the amount of challenges that obviously is currently facing the sector at the moment with the workforce and the financials and everything else, it must be quite a challenge anyway to sort of keep that that straight face and leadership, and sort of almost take on obviously the whole team's stresses and worries and everything as well, but still to kind of almost fulfill that role as a leader as well, because it's difficult, isn't it, obviously, to try and steady the ship, like you said earlier, all the time.
Definitely. And I would say that what Martin said earlier, for me, is the key to everything. We don't know everything. We never will know everything. And so for me, when the ship is not steady, and like right now, we've got an awful lot of challenges throughout the sector, but there are beautiful green shoots actually to be pulled through. And we need to talk more about them as well, about the green shoots that are coming through. But yes, when the ship is very unsteady, when the team is in turmoil, when the culture is broken, when we've got the press telling us, the care sector is this, that, the other, when we have all of that, it's so important for us as leaders to really lean in. And I think I suppose that's where we see real leadership, is whether you lean away or you lean right into it and go, okay, I'm in here with you. We're going to go through this. It's rocky, but I got you and you've got me, and we're going to work through it together. And I think that's where the leadership comes in, really.
Definitely, Samantha. And I think, having that plan, having that strategy as well, which is, Kathryn, I wondered if you wanted to kind of come in here and sort of share about how providers can set that framework out almost in terms of what that looks like.
Yeah, I think what we're talking about here really is kind of making sure that we're stabilising the workforce with,
Exactly.
the role of, we're talking about the role of leadership with regards to retaining good staff and focusing on the value of caring. And, how we lead, our leadership directly impacts on the retention of our social care workforce. And effective and supportive management will help to support and bolster that workforce and help them to feel that they're there. And, that's a real critical issue at the moment. We know that our turnover in social care is as high as it's ever been. I think Skills for Care have told us it's about 29% at the moment, which is very high. And, we need to really listen to our workforce who tell us that they might be worried about a lack of training or a lack of support, or they might be feeling undervalued or whatever. Those are the kind of things that are coming through on surveys. So what can you do locally to help that, local leaders? And I'm really interested in the comment Samantha made about people being potential leaders and managers or one or the other at different times, because they do have a different focus, a different view, as Martin says, but actually we might all move between those two at various times, and whoever's on duty at that time is both the leader and the manager sometimes, and needs to remember that and remember what their different roles are there, and think about how they can flex what they've got to be able to meet those needs. Now, for some services, training is harder to come by than others. I think that depends on the financial situation of the service, and that is very different in different areas. But there's different ways of accessing that, looking at what kind of training you can get for free from your local authority, what kind of training can you get online for free. For example, SCIE has some online training that's accessible, or online resources, and so do other organisations. Looking at how you can help people to feel supported, and there's something about very good supervision, good one-to-ones and regular supervision with the staff to talk about what are their worries, what are their concerns, and how can you help to support them in that. What are the options available to you? How can you make sure you've got a really good team spirit, so that people feel when they come to work they're there together to make the difference together. They all know what this vision is that we're aiming for every single person that they work with. So, this comes back to something as basic as care planning. Are we all signed up to that individual's care plan, and what that means for how we work with that individual and what we're going to be doing? Does everybody understand their part to play in that when they come in? Really good communication and making sure that, very, very often in care settings, the people that you're least likely to ask the opinion, as people have already mentioned, some of the domestic staff were the key leaders during COVID, but the people that sometimes you're least likely to ask the opinion might be the person that's really sat and had a chat with one or other person in that care at the time, and might know something that's really helpful to their care plan and helpful to how that person's feeling. So I think there's something about that overall framework that people put in place for staff training, support and leadership. And then I've got to mention co-production. How are we working within our service, our care setting, to really work in a co-produced way? And leaders really need to invest in that and invest in the resources for co-production. And that includes thinking about how we have the right capacity in place, how we have the people in place to help support co-production, how we involve people with lived experience to contribute to what that service looks like. And there is obviously the very obvious basics in the fact that they help to design their own care plan. They help to talk about what outcomes are coming for them, but also in terms of the overall setting, the overall, let's say if we're talking about a care home, a domiciliary care service, or even more of a community care service, how do the local people have an input into what that looks like and what outcomes we're trying to achieve there, and how we're really using strength-based practice? So how we're looking at people's strengths and seeing what individuals can contribute. And actually that applies as much to staff as it does to people we're working with, how we're really looking to use people's own strengths to get the best out of everybody.
Yeah, no, fantastic. And I think that's a really good point, just to think of the whole workforce and how each individual can contribute. And I think it was also just being prepared, isn't it? Like you said, obviously referencing the pandemic, having to step up with infection prevention control and knowing how to lead in those times of crisis, really sort of looking at the whole workforce leadership as leaders, I suppose. I was wondering how does a decision maker identify those leaders? What sort of characteristics throughout the roles, I suppose? How can we identify leaders and then also support them?
And how do leaders identify themselves? Sometimes the leaders they kind of rise up naturally. And I think, you know, when people are in a position to want to make a difference and to want to provide that vision, and they're coming up with the ideas, their managers, their decision makers can tend to see that they're coming forward, but equally that person themselves is going to know that, you know, I certainly know when I was in much more junior positions, I found myself thinking, if I was in charge, I'd want to do this, that, and the other. I'd want it to look like this. That's visioning. That's
the opportunity,
how you do it. And, you know, having those conversations and making it possible to have those conversations, that comes back to good supervision again. And career development and planning needs to be part of supervision, so that we are constantly succession planning and supporting people. Some people really want to stay in their frontline caring roles, and that's what they want to do, and they want to be great at that, and that is great. Some people want to know that they've got a career path and they can bring those leadership skills out. How do we help them to bring that out? And I think you know, sometimes good leadership can go hidden with people not asking the right questions or not feeling confident enough to say what they're really thinking. So encouraging those conversations. It might even be in a staff meeting, you know, what do you think should happen? What would you do differently if you were in charge? You know, and giving people different opportunities to put their ideas in place, that kind of thing.
No, it kind of goes back to those open lines of communication, doesn't it? And inviting that co-production, like you mentioned earlier, Kathryn. So, yeah, Martin, I did actually have quite a dedicated question for you. But to think about good leaders generally, maybe from other industries, anything that, you know, wider commentary that people listening can, kind of get them thinking, I suppose, in certain, you know, might be a certain scenario or a different industry where good leadership has been demonstrated.
Yeah, I mean, I think there are lots of different sectors where you see that good leadership, but actually I think the traits of good leadership are universal and they're absolutely applicable across all different sectors. And if you look at the leaders in the airline industry or in retail or in, I don't know, the theatre or whatever it is, there are some common threads that literally weave through. And it is that thing about visioning. It's also that thing about enabling. So it's about saying, you know, how do I enable people to give their best? How do I also nurture and develop people? And recognizing that sometimes the people who have the best ideas aren't necessarily the ones that shout the loudest. And it's about how do I create an environment in which people feel comfortable. Also, when there are challenges or indeed difficult crisis points, how do you get everybody facing in the same direction? You know, that's the other thing, and really taking a leadership role and making it everybody's business to lead through the challenge or the difficulty. Exactly as you said, Samantha, it was about how you lean into the crisis, not back away from it, and also how you have the time afterwards to reflect on what happened so that you're stronger for the next crisis. And inevitably, in any situation, life is a series of crises and we have to navigate our way through them. But I think the thing for me that's important is that we learn from them. How do we make them positive experiences, not negative ones? And unfortunately, and I think social care and social work is littered with people who've been destroyed by crises because nobody's been there to go through things with them, help them to, and enable them to see how they can use that experience to be stronger rather than letting that experience overwhelm them. And you see that in so many sectors. If you have positive cultures, if you're engaging people in every aspect of a crisis and saying, yes, it's a crisis, we're getting through it, we're clear about what our priorities are, but we're also clear that we're going to learn from it. What are the things that are going to come out of this? There are going to be things that are going to be very much about the organization, but there are also lots of things that are going to be about people and how these situations strengthen them rather than weaken them. So I would think those sorts of elements for me would be the things I would be looking for in leaders in any sector.
Yeah, and also something I was going to touch on is obviously not to go anywhere near a blame culture as well. And I think that's really important as well. So it's a productive and a constructive reflection.
Yeah, and I think also the challenge is that there will inevitably be people around the outsides usually who want to make it a blame issue. And I think there is also something though that is about how you give people the capacity and the strength to take responsibility and accountability for things that went wrong and not see that as about blame, but seeing that as about First of all, what do I learn from it for my practice? What has been the implication of what I did, and how do I work to make sure it doesn't happen again? And secondly, how do I work to try and put it right? So I think those are some of the things that for me are really important. But all too often in blame cultures, what happens is, and we see it so often, you know, I think of local authorities where anything goes wrong, people think the thing you do is sack the adult services director and then job done. Well, actually, that is not the way forward. The way forward is to be part of a learning culture that said, why did it go wrong? What were the causes of this? How do we support people to make sure it doesn't happen again? How do we come out of this with a better social care department, not just a changed one?
I love
Yeah,
that.
yeah. Samantha, did you have something to add?
Sorry, we're both hopping in. Do you want to go, Kathryn? Then I'll come in.
Yeah, thank you. I was just going to say, I agree entirely with that. And one of the things I forgot to mention, which Martin has kind of segued nicely into, is I think one of the really crucial components of a good leader is being able to show humility and vulnerability. And I think that absolutely leads to a learning environment. And, you know, I love the airline example. I just don't even know if it's true, but I've been told this a long time, that if a pilot admits his mistake within 7 days, he doesn't get into trouble for it. And I think we should have something similar, because, you know, we do staff engagement surveys regularly, and a lot of organisations do staff engagement surveys to look at how their staff are feeling, how engaged are staff feeling. The more engaged your staff are, the better the service will be. And one of the questions that we put in our engagement survey is, would I be forgiven an honest mistake? And that is really, really crucial in terms of the learning culture. And if people don't feel able to make an honest mistake and don't feel able to be innovative at times and be able to take a managed risk, then you're going to end up with a really stifled service where people are not getting the best out of that. I think it's really important that people are able to make a mistake, to learn from that mistake, and to all have that conversation together. And equally for the manager, for the leader, to say, actually, I called that wrong. It was worth a try, but it didn't work. Or for the leader to be able to say, do you know what? I don't really know how to deal with this. I've never come across this before. Do any of you know? Right, maybe I need to speak to some other managers, some other leaders, and see if somebody else can give me some advice. And just occasionally showing that humility and vulnerability opens the way for the staff team to be able to do the same thing.
Yeah, no, yeah, leading by example, literally.
So for me, that is really, really important. And I love what you said, Martin. You know, we need a better service, not a changed one. And I think it's we're too quick to take out leaders and swap them in for someone else. And just, I get a bit passionate about this, so I'll shut up.
No, it's all good. No, I like that. Yeah, I think that asking why it's really simple, but it's really important. I don't think people do it enough, to be honest.
We don't do it enough. And that's why I always look to people when we do our assessment centres. We're looking for people from outside of the sector as well as inside of the sector. Would I have done that without that experience? I don't know. Maybe I would have learned it from another brilliant leader, but I learned it then. But I think that if we focus in on back to the retention, back to supervision, back to all of that, we come to a really key point of what is our retention strategy? We've got recruitment strategies everywhere, but do we have an actual retention? We have a retention strategy. So we put retention first, then recruitment. And then retention strategy includes all of this. So what is the culture that we are really leading here? And really my thing there is, do people feel whole when you leave them? So as a leader, and I know there's been times over my career many years ago where I would have left a room and people wouldn't have felt whole. And a lot of the time that's a reflection of the leader in place, by the way. You have to learn your stuff as you go. But actually now, literally every day as a leader, I go back and I review my day and I make sure that everybody I had an engagement with that day feels whole. It might be that they can't have the job anymore because they're not doing it. It might be that something really bad happened, but do they feel whole? And as leaders, we have the ability to leave people feel whole and to learn from something rather than feel berated by something. And that's the key for me. So the beauty is in the learning and the improvements in what we do afterwards. So yeah, that's.
Thanks, Samantha. Yeah, no, I really appreciate the honesty as well that you shared today, and I think that's so important as well. Just to be honest and to be real. Kathryn, I just want to touch on training because we haven't really mentioned sort of on obviously continuing professional development, training opportunities. and any courses within leadership. And Samantha, you might have some yourself that you would either recommend that you've been on, or something that's coming up in the future. So I wondered if you wanted to touch on sort of training and any courses.
Yeah, absolutely. And there's lots of different training opportunities for leaders, you know, in terms of more formal management and leadership training, and more informal in terms of kind of on the job training. One of the things that SCIE offers is something called strength-based leadership, and we offer training courses on strength-based leadership. That is where we ask people to look at the people they're working with, look at the strengths of the people they've got, and look how they can lead with those strengths, and how they can support people they're working with to lead with those strengths. We do something called practice with impact, which is where we get people to work in that way and to work with a strengths-based way with people to really have the impact that they're looking for. And there's some really good courses there, and we can do them kind of individually or as a collective. We've got lots of online and e-learning courses that are separate, but some of these, the strength-based leadership are the places where I think we see the most impact and the more different from kind of traditional leadership and management course that I think you can access elsewhere. So I definitely recommend that for people.
Brilliant. Thanks, Kathryn. And Samantha, did you have any?
I've done a lot of different courses over the years. I keep learning. I'm reading a book at the moment, and it has it's got things I have to do every day on it. Sometimes it drives me mad, but I have to do it because I have to, you know. So I listen to a different book every week. So part of our leadership strategy is actually I've given everybody Audible. So everybody's got an Audible account. And what I do is I send out a leadership type book. Might not seem like it initially, but I send out a book that we all read, and we can listen to it actually rather than read it. A lot of people don't love reading, but they'll listen to it. And then what we're doing is we're reviewing that book and what we've learned and what we might take forward as leaders in the business. So and for me, I've learned so much in the car. You know, we spend a lot of time in the car, and I listen to it. Honestly, listen to a different book every week. But for me, Simon Sinek, you know, he's got a book called Know Your Why. That's where it started off. You know, it's really, really good. And his next book was Leaders Eat Last, which is really important because we're talking about, you know, vulnerable leadership. And of course, we have to mention Brené Brown because she's amazing. But I think, you know, I've been at Henley Business College for different leadership courses, been on SCIE, Skills for Care, do some great things as well. And I think putting yourself forward, not just to be the learner, but also to support the learner. So, you know, if you want to step into leadership, offer to mentor different people and look at different companies as well. So one of the things in Simon Sinek's books, there's lots of other great leadership books out there, by the way, just not those.
Yeah.
But in one of them, he talks about a conversation he had. He did a lot of work with Apple and Steve Jobs. And he talks about a conversation he had with one of the leaders in Apple in a car one day. And he was really trying to rile the guy about a Google phone. Did you? Kathryn's going, yeah, because she probably had. But he was really trying to rile this guy about what Google had done and what they were doing with their things. And the guy was going, that's really good. That's excellent. That's really good. Really was very, you know, was not worried about the competition, essentially. So what we need to do in care is not look at the competition. We need to look at people as this is a sector that needs to hold itself up, offer to be a mentor for somebody, offer some time to different companies. You know, if something worked for you, share it, because that's really what, you know, what we need to do, because it's a sector where everybody gains if one person learns something different. And we have to be continually you know, inspiring people to be better than we were today. So for me, that would be give it away. And that's where the Outstanding Society comes in, and that's where we work with Care England to just give away that information all the time. Because it's important, because my mommy will be in a care home. I've already told my children I'm okay going to a care home because I've seen so many families destroyed by the decision. I've said, you know, a care will be brilliant by the time I need to be, you know, there. And there's some brilliant care places, you know. So I think what we need to do is create tomorrow and be the leaders that create tomorrow. And that means actually bringing in everybody in now and working with them to do that.
Yeah, fantastic. Thanks, Samantha. Lots of very inspirational quotes there as well. It's quite powerful, so off the cuff. But Martin, we actually spoke on our previous podcast with Martin from Shaw Healthcare. And Martin actually spoke about how, you know, the well-led element of his organisation didn't actually get the rating that he wanted. And I wonder if we could possibly touch on briefly around that, building the evidence for the regulator around a well-led, and what providers can really do to, and Samantha and Kathryn, but to sort of demonstrate that, I suppose, obviously, other than coming and seeing it for themselves. But how do you build the evidence that to show that you are a well-led, well-run organisation?
Well, I think it's extremely difficult if people don't actually go into the service. I mean, I think when you go into services, you talk to people who use services, their families, staff members, you then get a really good picture about where the leadership has positioned that service. In terms of the parameters that you would show in, you know, for example, in data, I would struggle to know what those would be, because you would have some very clear outcomes, and they, you know, could be about some process-driven stuff. But actually, this is about how the organization functions as an organization. And I think on some levels, you've got to touch it to have that view as to whether or not you think that leadership is devolved throughout the organization, everybody's on the same page. And I think it's quite difficult to do that with data sets as opposed to engaging and you know, being part of the service. I don't know whether you would agree with that, Samantha. I mean, you're somebody who's an outstanding leader, and you've got the tick in the box to prove it. But I don't know what your view would be.
It's really tough, Martin. Honestly, I mean, do you remember years ago when it was SCIE and you'd sit beside them in the room, and you'd have a lovely chat, and you know, we'd be kind of, oh, you didn't do that right, and it was grand, and it was very different then, and we had relationships as opposed to trying to put things through a data set, if you like. And this is the challenge that a lot of care organizations have now, and will further have when the changes come in that are due to come in the coming months, because everything will likely go through a portal. We'll have to be able to kind of grab that evidence and really kind of write it down. There's a few things we've put in place. So, for example, we've got each of the areas, so well-led, you know, each of the areas written down. And what we're doing is each month we're asking families, residents, team members, professionals, everybody that comes in, tell us how you see us as well-led in your interaction this time. And we're saving all of that and literally going, okay, and then same for safe, same for caring, same, so that we can actually kind of get this as a, I suppose, a constant feedback way to kind of put through that portal, because you know, people who are not seeing and meeting and hearing what's actually happening in home, you can feel it. You just have to walk in. You know, you walk into a space and you know whether the team run away from you or run to you. You know, you know, you know how people feel. So we're going to have to try and capture all of that. So on each of the to evidence outstanding on each area, on every team meeting, on every resident meeting, on every relative meeting, on every MDT, we're asking, how can we all, because we're working in partnership now with LAs, ICBs, how can we all demonstrate outstanding in this outcome? So that we're constantly keeping it in the front of our minds and writing that down and then getting that up and putting it into the portal. But it's not the same. It's definitely not the same as, you know, walking into a service and team members running up to you and going, let me tell you what was going on here. You know, it's different. It's very, very different. But I think if we have everybody kind of thinking about how we evidence in it, and you know, we all know on here, homes are doing amazing, brilliant, outstanding stuff every minute of every day, but they just think it's normal. Like they just think that's what we do every day. So it's about how do we help them capture that, because they're not going to, they're not. So literally these forms kind of talk about, this is the outcome, this was amazing, that's actually outstanding, let's put that forward. And so that's the kind of thing we're trying to help people do, to try and get ready for the even less inspection-led way that we'll have in the future, which could be, we don't know yet. But,
and it's also showing that continual improvement, isn't it, as well? I just apologise. My cat and dog were having there, so apologise for that. And knocked my microphone off my jumper.
For those listening, we just saw Kathryn's cat.
I love that.
They were
Got
having
a
a
name?
fight. The dog pulled the microphone, chasing the cat. But anyway, yeah, and I think it comes back to, if you think about, why do you want to be outstanding? Do you want to be outstanding because you want a badge that says outstanding?
No.
Or do you want to be
It's the
outstanding
experience.
because you truly believe that your outstanding service will deliver an outstanding service to the people that draw upon that service? And that, and it comes back to the values that, it takes us right back to the beginning, really, that Martin talked about at the beginning, why we're here, why we're doing this. And something around the planning and the action planning, and how, so if you say you want an outstanding service, what does that outstanding service look like? What are the elements that make that service outstanding? And how will you get to there? What's your plan? Can you evidence the plan? Can you evidence the impact that plan has had, the difference you've made? And there's also something about continual improvement, which is what I was going to say, because it takes me back to Ofsted, which is slightly different. But I remember a service getting, I suddenly lost my mind as whether it's outstanding or excellent in Ofsted. But anyway, they got outstanding one year, and the next year they only got good, and they hadn't changed anything. And they only got good, but the previous year they'd got outstanding, and they were really annoyed. Why did we only get good? We got outstanding last year, and we've done exactly the same. Well, there's your answer. You've done exactly the same. You've not done any learning. You've not done any development. You've not moved on. You've stayed still. And actually, if you really want to be outstanding, it goes back again to that continual learning, continual listening. Are you listening to the people that work in your service, that draw upon your service, the family and friends of those people, to say what would really make a difference? What would really make this service outstanding this year? And what can you do about that? Have those plans written down. Show that you're actioning those plans. Have the action to those plans written down. Make sure that these plans are supported by the vision. This is what you're aiming for in the first place. This is what outstanding will look like in our service. And then going back to what Samantha said, this is what people say about our service and why it feels outstanding to them, but also showing, again, that humility. This is where we got it wrong. And this, I think, is crucial. This is where we got it wrong, but this is what we're going to do about it. Or this is what we've done about it is even better. So this particular element of our service wasn't working. I think of something really simple. Somebody didn't like the food, for example. It didn't work. We didn't get good feedback about this. So this is what we're doing different now to make sure that people get a full say in the kind of food they can receive here. That's something simple, but you get the point, I think, and it's able to demonstrate that continual learning and improvement and what outstanding looks like and how you're going to get there and why.
Kathryn, I'm just hopping in there because, when I go in, I've been in different companies, and when I go in and I hear there's no complaints, it terrifies me.
Absolutely.
Terrifies me.
And no safeguarding issues.
Honest to God, or no meds errors. Those kind of things immediately go, oh my God, people are not telling us stuff here. So, and we don't have complaints and compliments. We just have feedback. We get feedback. It's feedback. It's all feedback. But actually, trying to help home managers gather that just as you said, that data, because somebody's cardigan is shrunk in the wash and the daughter's just passing by your door, they're leaving, oh, mom's cardigan was shrunk in the wash. Actually, you can leave that as not, okay, I'm not going to deal with that as a complaint, or I can. And actually, what can I now do to actually prevent the next person's cardigan being shrunk in the wash, because that annoys everybody, but also sharing that's the stuff. So it doesn't have to be a massive big issue. It's small little things that break services. It's very rarely something really huge. It's all of the small things that we just let go and just go, well, that wasn't really coming. Well, it was really, so how do we deal with that? So catch the small things so that we prevent the big things from happening, and just trying to get people to kind of concentrate on that. It's really important. And just one other thing I would love to talk about here is Paretos Law and the 80-20 rule. So we tend to spend 80% of our time with 20% of our team, because they're the ones who need the kind of the work, the management, and the same with relatives, the same with residents. And we have to ask ourselves, I literally ask myself every day, okay, look at Paretos Law. What did I do today? What did I concentrate on? Did I concentrate on the vision and what we're trying to achieve, or did I actually concentrate on something else? And how do I deal with that so tomorrow I can actually focus on the vision and moving forward? Because in care home management, it's tough. It's very, very tough. And trying to find what I should do first, second, third, it's really hard going. So I think for managers to have leaders who actually take that time to sit down with them and take time to kind of go, okay, so what's going on with you now at the moment? What's taking up your time? Where can we help you to to achieve what you want to achieve, that's where we as leaders come in. And instead of saying, why isn't this done, say, help me understand what got in the way so we can work on that, because there's different ways we can do it. And it's that approach that's going to help us retain people.
And also I think like certain element of like delegation comes into that as well, as in effective leadership.
Exactly, everything
that some people do struggle with, but it's not being afraid of saying, actually that person might be able to do that better than I can.
Probably
and,
will. Probably in my organization, I've got so many people who are brilliant, honestly. So they're brilliant at loads of different things that I'm not brilliant at. So they will be better. And if we're really good leaders, we'll pull all of those good people around us. And I'm always looking for the next person who wants my job, so I'm getting them ready, and then the next person, and then the next, because that's actually what's going to actually help us move the organization forward. So definitely the answer is typically there.
Yeah, I think I read a book recently called The Answer is the Question, and it was about that constantly engaging people and asking them about things and just finding out what the issues are and then working on them together. And it really does make a difference. I also think there's a really interesting point which you made, Kathryn, about why do we want to be outstanding? And so often people forget that the regulator's not responsible for their quality. It's them that's responsible for their quality. It's everybody's business to deliver quality day in, day out. And, in a way, the regulator is the bit that ticks the box for validation, but actually it starts and ends with the people who are in the service and delivering the service. That's where we need to focus on. And those are the people who should be our primary target for whether or not this is a outstanding service. And the people who use the service are the people who should be telling us that day in, day out. And the people who work in the services should be telling us that day in, day out. But I think it is a major challenge because of this time issue. And you made the point, Samantha, about how you have to give people time to reflect. And in a pressurized environment, that's very difficult sometimes, and particularly as well, because we do work in an environment where there are so many things we've got to do which are process driven, and sometimes they get in the way of the really important stuff, which is about what we're trying to achieve. And so that's another way where leaders and managers have a really important role. It's about giving permission for people to focus on the really important stuff rather than the process stuff. And it brought home to me, I went to an outstanding service actually, and I was talking to the manager, and she said she began the conversation with the inspector, which said, I'm sure you'll find lots of issues and we really want to hear about them because we want to fix them. And she also said, and there will be things that didn't happen. And the reason they didn't happen was because we put the people who are at the centre of this service first, and they were more important than a process or a particular piece of paper, etc. And through that conversation at the start of the arrival of the inspectors, I think she really set the tone for the inspection, and that really helped. So I just think there are some issues like that. There was another service as well, which was quite interesting, where the manager was on leave when the inspection team arrived. And there was a great moment. I happened to be in the first meeting the next day. And they went through a whole raft of things. And then the deputy manager said, and just to let you know, the CQC arrived yesterday. And the manager,
there we go, I love it.
The manager said, well, why didn't you tell me? And she said, because you weren't here. The service was how we delivered it that day. They were coming to see whether or not it was good enough. If it wasn't, we'll find some lessons that we can learn. And when you're not here, you're not here. And that was such a fantastic and positive example of how everybody in that organisation understood that it was their role to deliver high quality service. And just because the title of manager, that person wasn't there, didn't mean that they all went into a spasm or the manager thought, oh, we have to have you here because there's an inspection. So again, that for me as well would be a really clear indicator of good leadership and good management in a service.
I agree with that. And you reminded me years ago, I am going back a long time here, Martin, but I was leading a care home, and I'd put a lot of effort into, it was called Excellent in them days, but I'd put a lot of effort into getting it to be excellent. And it was in the days when we used to have announced inspections, and I went into labour a day early, and
Oh gosh.
And my inspector was due the day after, and I remember sitting in the hospital bed secretly ringing the care home from under the covers of the hospital bed. I'm not going to be in today. And they said, oh, have you gone into labour? I was like, no, I had him yesterday. And I was really worried. And do you know what? The inspection went great. And the reason it went great is because I didn't need to be there. And actually, if you do need to be there, that's not great leadership. And one of the things I've seen over the years in various roles is a really great leader come into an organisation and you can see that they're a really great leader. You can see it's fantastic. The care home improves, the outcomes improve. That person leaves, it goes straight back down again. And actually, if you want to really be a great leader, it's how do you make this sustainable? How do you make sure that when you're not there anymore, it's still doing a great job? And that's actually a lot harder to achieve. How do you make everybody that you work with just as capable of leading that vision as you are when you're there?
Yeah.
And the one thing that I've also just want to mention before I forget is also when you go into this service, be it a care home or whatever else it might be, have a look at it from a different viewpoint. Have a look at it as though you were considering it for your mom or your grandparents or something. And what would you look at if it was for them? What would you do differently? And I say this to you because I just, again, use another anecdote. I was an inspector for a few years around the Bradford area. And then I became a senior manager around the Bradford area and was responsible for all the residential and day care in Bradford. And so when my granddad needed care in Bradford, I knew exactly which were the excellent homes. And then I went to look at them with my aunties, and wow, did I see them through different eyes when it was for my granddad. The ones that I had previously thought were excellent and that I had rated excellent as an inspector, there was no way I was putting my granddad in those care homes. And suddenly I was looking at very different things. So do that, take a step back as leaders, tell all your staff to do the same. If you were putting or supporting your parent or a loved one to move into this service, what would you like and what wouldn't you like?
I think we mentioned that our last podcast actually is like, would you like to live here? I think you might mention
absolutely.
Martin, yeah, I think
in our audit it does say, would you choose this care home for a loved one? We ask that question because we have to. If we're not willing to answer that question, what are we doing? If it's not good enough for my mummy, it's not good enough for your mummy either, you know. So we ask that after every audit. Would you be happy about a loved one living in this care home? I did have mammy, but people didn't know what it was most of the time, so I thought we'll have a loved one. But honestly, that is the key question, and also getting people to swap over again, you know. And it doesn't have to be. This is for what people who run one service or you know, a small home. Don't worry about not being part of a group. Go down to the next care home down the road and say, can you come in and walk my care home? I'll come in and walk yours. And I'll walk it as if I'm looking at this from my mummy's perspective. And I'll give you honest feedback and you can give me honest feedback. That's how we can hold each other up, you know. So it's about actually doing that and doing that honestly with different people. Because I think we get blinded sometimes. You go into the same place all the time. You get used to it, don't you? And
you need that fresh perspective.
Yeah, and somebody else's perspective, you know, on your service is really, really important. But I totally agree, Kathryn. Honestly, I look at everything we do. Is it okay for my mummy? And my mummy is a tough Irish woman, so let me tell you, it's hard to get it to be okay. But that's the way it has to be. And if whatever I'm doing today isn't going to improve her life, so therefore everyone else's life, what am I doing it for, really?
Do you know, and I think one of the other things that leaders and managers have to do, and particularly in care services, is manage risk. Yes. And one of the things that we don't do enough of is that managing of risk. So a good example was my father, after my mother died, went into a care home, and he'd only been in the care home for about 3 weeks. And he happened to be talking to a member of staff, and he said, when my wife was alive, she used to drive me down to the library, dump me for 3 hours, and when I had enough, I'd pick up the mobile phone and she'd come and collect me. The member of staff said, well, we'd love to dump you for 3 hours.
Oh my God.
Oh my God.
Now, it worked brilliantly. That's exactly what
I love it.
The library. He was at the same library he was at when he lived in the small town, and he knew people. But my cousin rang me in an absolute panic one day and said, I've just seen your father in the library on his own, as if somehow the care service was doing something absolutely dreadful in allowing him to lead a life. And frail as he was mentally very alert. He was able to use his mobile phone. He went to the library, he chatted to his friends, he did all the things he used to do. And it's just really interesting, though, about how we enable people to take risks well. and recognise that some of those risks are going to perhaps have consequences, but it's about how we enable people to have a good life. And I think one of our problems is that often people talk about, is it a good service? Well, I want a good life, and I want the support to live well. And that for me is the definer of an outstanding service.
Oh, I'm going to come in on that when Martin, I tell you, I was setting up the website for this new company, and I was trying to get it to be different. So I wanted same-sex couples over 50 because there's none. Just like, where are they? like let's get them on the website. We wanted to show that things will happen here that you might not expect to see in a care home. And I was trying to get it across to somebody, and I said, look, the first outing is to a trampoline park. And they were kind of going, sorry, what? You know, I go, trampoline park, we're going to a trampoline park. And they're going, well, with older people. I was going, yes, because older people like trampolines too, you know. So it's about positive risk, isn't it? And yes, we risk assess, and yes, we look at everything. But actually, older people have lived lives that we will never even be able to live. So why are we not enabling that to happen?
I'm conscious of time, and everyone's very busy, and you've got probably a lot to get back to for the day. So I wonder if we could have a sort of I suppose a final tip really from each of you on what makes a good leader, or something that our listeners can sort of take away, and a sort of one top tip really from each of you. So Kathryn, I don't know if you want to start away, if there was something that you wanted to.
I think my top tip goes back to what we started with, which is about be clear on what your vision is. Have that vision inspired by what you would be looking for if you were looking at this service for your family member, your loved one, and make sure that you've got a plan to how you're going to get there.
Brilliant. And Martin?
I think just recognise the values in the organisation, but also recognise everybody's different skills and use them effectively to reach that point, as Kathryn said, where you're delivering the service that would be the best service that you would want to have for yourself or a loved one.
Fantastic. Yeah, definitely. And Samantha?
I'd say we're in an amazing position. We lead the people who touch the hands of the people, the most important people of all. So as a leader, leave people whole, because they're the people who are going to be in the room with the mum, with the dad, with the person who needs the support. And if people don't feel good and don't feel valued, and they go into that room to give care, that is going to be felt. So every single time we interact with a team member, no matter what role they do, just remember that interaction could have a direct impact on somebody's mummy. So it has to be a good impact every single time.
Brilliant. Thanks so much. Thanks so much, Samantha. That's really good. Thank you everyone as well for sharing your thoughts today. And yeah, I look forward to hearing the reactions. I'm sure if anyone's got any questions, they can contact you directly. Samantha, I'm sure you might have more to share.
In other words, she said, we got the Irish woman on, she won't shut up.
But I'm sure there's a lot more that we can discuss. But yeah, no, thanks so much for our speakers today. Professor Martin Green OBE, who is the Chief Executive of Care England, and also Kathryn Smith, who's the Chief Executive of SCIE, and Samantha Crawley as well, who's from Bracebridge
and the
group, and also non-executive director at the Outstanding Society. So yeah, I'll look forward to hearing more from you in the future. Thanks everyone.
Thank you very much.
Thank you. Thanks guys, it's really interesting. Thank you.
Thank you for tuning in to CMM Off the Page. Explore CMM's portfolio of content, including daily news, blogs, a magazine, and CMM Insight webinars by visiting www.caremanagementmatters.co.uk. To make sure you don't miss a podcast, follow CMM on Twitter @CMM_magazine and use the hashtag CMM Off the Page to join the conversation and share your feedback. See you next time. CMM Off the Page. Listen, learn, lead.